Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
What is the WHO classification for hydatid cyst? According to WHO, hydatid cyst is classified into five types. One we have CL type. In CL type, there is a well circumscribed cyst is seen with a clear defined wall and which is filled with a liquid. You see well defined cyst which is filled with a liquid and well defined wall is seen which is CL1. Okay, then we have CL2. What is seen in CL2? Right, CE1. One is CL1, which is well defined cyst with a liquid image of clearly defined wall. Then we have CE2. In CE2, there is concentric hyperechoic halo is seen around the cyst. So this is the cyst. Around the cyst, you see a concentric hyperechoic halo will be seen in the cyst, and this cyst will contain, obviously it has a fluid. Along with this fluid, it has a hyperechogenic foci is seen, which is called as hydatid sand. So this is CE1. In CE1, there is a concentric hyperechogenic halo is seen around the cyst. You can see this halo. Along with that, there is a free floating hyperechogenic hydatid sand is seen in the cyst. So this is CE1. Then we have CE2. In the CE2, there is multivesicular cyst is seen. In the CE2, there is this is the cyst. There is multivesicular cyst is seen with daughter cysts, granddaughter cysts, all these are seen, and this will look as though there is a rosette arrangement or spoke of wheel arrangement or cluster images arrangement is seen because of multiple daughter cysts which are present. So this is CE2. Then we have CE3. What is seen in CE3? Okay, in CE3 actually okay, this is CE2. Now in CE3 there is this is the cyst and there is partial or total detachment of laminated layer is seen with floating undulated hyperechogenic membrane is seen showing dual wall. So this is the floating hyperechogenic membrane which is showing liver, see, two walls are seen. So this is water lily or snake sign, water snake sign. So you see a laminated layer which is floating in the cyst, and this gives a water lily or water snake sign. Then we have CE4. Now in CE4, here in CE4, you will see that there is in the cyst. Okay, this is the cyst. In the cyst, you will see that the daughter cysts are visible. So there are solid components are seen with cystic components are seen. So here you will see presence of both solid and cystic components are seen in CE4. Then we have CE5. In CE5, there is matrix or amorphous mass is present. Actually, in CE5, there is a matrix type or amorphous mass is present. There is a solid area. This is a semi-solid area. Then there is a solid area. Then we have a semi-solid area. So there is solid area is present with semi-solid area is present with also calcifications, also limited amount of calcifications. So this is CE5. So among all these, actually, only completely calcified cyst or eggshell appearance is accepted as dead cyst. So, CEL, CE1 and CE2 are active fertile cysts because CL contains well-defined wall with complete well image, whereas C2 also contains good hydrated fluid, whereas Ce1 contains good hydrated fluid with hydrated sand, whereas Ce2 contains cysts. The rosettes and cysts are present. So these three are fertile cysts. Whereas Ce3, here there is a detachment of laminated layers started. So this is a transitional cyst where degeneration is started. So Ce3 is a transitional cyst where degeneration is started. Then we have Ce4. Ce4, if we see Ce4, already there is solid tumors and cystic tumors are seen, but there are no daughter cysts. So already this is actually, this Ce4 is already a degenerated cyst. Ce4 is a degenerated cyst, whereas Ce5, in Ce5 already you are seeing calcifications are visible on Ce5. So because calcifications are visible on Ce5, so Ce5 is a calcified cyst, and finally C4 and C5 are the total inactive cysts.
Thank you and thank you for watching.